Now, we'll talk about the case that a lot of doctors, when they first encounter it, or a lot of teams, consultants, down to junior residents or the junior trainees, would normally find perplexing, but more along the lines of interesting, amusing, and it's nice to talk about it. Some even would border on kind of strange, irritating, or funny. Let's start with a fairly young pre-adolescent or adolescent, let's say 12 to 14-year-old, and this involves a procedure that would remove a significant part of the body, like somebody has a cancer, like a muscle or a bone or a cartilage cancer. Sarcoma would be one, and it would need an amputation of one of the limbs, maybe an arm or a leg, or it might even be a removal of the jaw if it's a cancer of the jaw. And so the perplexing situation is this: the kid comes in and they do the studies. Now, normally kids this age, they tend to think already, but nobody tells them, or they have a sense of what's happening, but they also don't talk about it themselves. Like mutual silence. They don't want to trouble their family or their parents, and the parents don't want to go into a situation where they don't think they'll be able to handle or predict the emotional reaction of their kid, and they're trying to be protective. The doctors probably are also thinking the same way as the parents, especially if they're in an institution or they've been trained mostly along the clinical lines, and there's very little experience during their training on what to do with kids or how to communicate with parents and kids or how to deal with situations that's very perplexing to the kid or very emotional to both parent and kid. Like, we're going to take off the arm of your child or of your 12 to 14-year-old, or we'll take off the leg of your 14-year-old, or we'll take off the arm of your 13-year-old, and she's in high school or she's about to enter college. She's very active, and for the rest of his or her life, he or she will be walking around with one leg, or walking around with one arm, or with half a jaw. And so the curious situation happens when doctors have finished their workup, and then they tell the mom, well, it's causing a lot of pain and it's going to get bigger, and the evidence-based scientific approach as far as our knowledge base is concerned, his or her best bet is for us to remove the growth. If the discomfort would be less, and there's a greater chance that he'll live longer, or let's say even get cured. And we have to do that right now, and we cannot wait for too long. So now, depending on how busy the institution is, it's a lot busier if it's a charitable institution, or even institution serving the lower to middle class socioeconomic groups. They know that the resources for prolonged hospitalization is much less. Now, for charitable groups, they want to do it as fast as they can so that they can help some other person. Now, for training programs, sometimes the issue is, there's lots of cases to be seen, and, we're not after the talking and the emotions. It's pretty obvious that we need to do it, so let's try to do it as quickly as we can, like within the next 2 to 4 days. And then the situation arises. Should we tell the child? Should we tell the kid? Mom, go tell your kid we're going to remove her leg 2 days from now. Or please tell your boy that we're going to remove or amputate his arm or his jaw tomorrow, or 2 days from now, or 3 days from now. And the mom would say, should we do it right now? I mean, maybe we shouldn't. Maybe we should wait until it's over. I don't know if I want to do that. So the care team would say, well, do you want us to help you do it, or do you want us to do it for you? And the answer of the mom would be, I'm not too sure that I want you to tell my kid. Okay, so now we have the interesting, amusing situation. If we just go by the textbook, well, it's pretty obvious. Less discomfort, less pain, greater chance of living longer, or maybe even getting cured, as opposed to the complete opposite. So what would you choose? Of course, you'd choose taking off the body part. But then, in most countries, the situation also is just like getting a consent for surgery. If you're going to do or say something that has the possibility of causing significant psychological harm to the kid, such as telling the kid this will happen, you should tell the mom. You're only obligated to give the information to the legally designated guardian of the child, or the legally designated decision maker, which would be the mom, should you tell the kid. Or you cannot tell the kid without the mom's permission or approval. If you tell the kid and the kid goes into a nervous breakdown, traumatic mood or anxiety or stress problem after you told the kid without permission from the mom, then that would be a big problem. That's the situation. And so several teams who haven't encountered this kind of situation might say, well, this is very interesting. What do? We need to do it. Obviously, she wants us to do the surgery because it's pretty obvious to her, but she doesn't want to tell her kid. She actually even said, well, maybe we shouldn't tell him or her right now. Maybe, tell her after the surgery, after we took off the leg or after we take off the arm. Maybe just tell my child afterwards. That's where the amusing, irritating part happens. It sounds ridiculous for some. Like, what do? We tell the child, well, we're just going to go on a simple trip somewhere, and then you put in a sedative, the child sleeps, and then he wakes up with no arm, or with no leg, or with half a jaw. Now, obviously, what will the child say? Well, what happened to my arm? What would you say? Obviously, you cannot say, well, yeah, you're right. What happened? Let's look for it. I mean, that's ridiculous. That's crazy. Some people will even say that's foolish or stupid, right? So it's pretty obvious for people reacting that way, for doctors reacting that way, that, there's no way you cannot tell the kid before taking off the body part. But then the mom is saying, you can't do that. I'm concerned. I mean, the assumption is she's saying that because she's concerned that it will cause significant psychological trauma or harm to the kid. And then the question is, what if she's right? The rule is there because the assumption is the mom knows her child better than the doctor. And usually that's the case, especially if you have an institution or doctors who are not very interested in the psychosocial or emotional reaction of the child to whatever they do, or the illness, or the hospitalization. And there's lots of very scientific, highly technical, but at the same time highly impersonal institutions. So what do you do with that, right? What if she's right? So you tell the kid without the mom's permission, and then suddenly the kid starts having an emotional breakdown, starts shouting all over the room and all over the place, and then trying to get the IVs out, and cannot be consoled. And so the team would end up sedating the child. The child sleeps, and then they do the surgery because the mom wants the surgery done. And this time the child knows that the doctors are planning to remove the arm, and so the trashing child was sedated. He sleeps, and then he wakes up without an arm. Same thing, right? So a very emotional reaction coming from the kid. Why did you do that? He was telling everyone, he was shouting that he doesn't want it done. Then he got tied down on the bed, he got sedated, and then he wakes up without an arm. Doesn't make sense also. And the mom can actually file a complaint because the doctors went ahead and communicated the amputation to the child without parental consent. So that's the situation. So it's perplexing for some. Sounds amusing for some, and I wouldn't be surprised if some medical providers would find it funny, right? Like, what happened to my leg? And then what would the doctor say? Yeah, you're right. What happened? Let's go look for it. That's a very stupid situation, even for our imagination. So now, what happens afterwards? Well, it depends. In a very technical, academic, scholarly institution, it might go this way. The mom says, don't do it, and then the very learned experts and consultants would say, well, that's very interesting, let's talk about it, because it's ethics and law, and doctors like feeling that they're experts in everything, so they have this mini session. I wouldn't be surprised if several departments or sections or units are actually talking about the same things. It's very interesting and somewhat amusing. And then they get all sorts of papers out of the medical ethics literature, and they might even invite lawyers. What happens if we need to amputate a body part and the mom doesn't wants it done, but doesn't want to consent to telling the child that it will be done. And you look all over the literature, you might find a few opinions, but there's not a lot of things to go by with, right? So now, if you go basic, you might encounter things like assent and consent. Well, the consent comes from the mom because the child is a minor. It's like 12 to 14-year-old. Assent would be, it might not be good psychologically or emotionally for the child if you don't tell the child what's happening, especially if it's old enough. And 12 to 14-year-old is old enough. But that's not a legal requirement. It's ideal and it's encouraged. But what if the mom says, you'll cause psychological harm to my kid? And so you talk about it, and it's like a nice little conference, and then doctors give their opinions. Of course, I can imagine what would go on in those conferences. I found an article written by this famous European medical ethicist who says that, this is what we should do, and this is probably related to the case. It's probably not related to the case because it's such a very unusual situation, but, it's somewhat related, and maybe we should go along with that. Or somebody comes in and say, well, in legal literature, this is what you should do. That's usually how things go. And after all those gibberish, nothing gets solved. But everybody comes out feeling smart and feeling very learned and scholarly. The thing about doctors is, after they get an MD after their name, some of them would feel like they're experts in everything. Like they're experts in medical ethics, even if they only had like 1 semester of ethics, or experts in law, even if they slept through the 1 or 2 semesters of medical law, or they're experts in business, even if they don't really know much about anything. It came with the territory. That's modern medicine. Before, doctors used to be very decent, simple, humble people. Well, after you pour in money to the system, well, you have a whole bunch of experts and consultants who are the complete opposite of that. Well, anyway, that's not the topic. Then the conferences or the discussions, the scholarly discussions end, and of course, obviously, nothing gets solved, but everybody comes out feeling that they know a lot of things. Now, if they're fortunate enough that they have a few doctors who actually think well or are more grounded, they can ask that doctor, well, what do you think? And the doctor's answer is probably, well, I don't know. How would I know? I don't even know how I'll react if my own child is going to get an amputation. I have no idea how emotional I will be. Do you have any idea how emotional you will be if your own child, who's planning to follow your footsteps and become a doctor, or is planning to be an engineer, is about to lose a leg or an arm? And even worse, the doctors are telling you to do it right now because they want to do it within the week. Would you say yes right away? Well, maybe if you're a doctor. Maybe if you think that, it's just a hypothetical question and it's really not going to affect you. But what if it's really happening? How would you react? You don't know yourself, probably. How would your child react, even if it's your own child? Of course, you won't tell your child if you fear that he'll react very badly, if he's going to get traumatized by it. You'll probably just say, well, give me some time. I need to figure things out. I mean, it's not an easy situation. It's not like some car mechanic telling you, well, we should remove the tire, replace it with a new one. Or the air conditioner is gone. Let's take off the evaporator. I mean, it's, we're talking about your child. And the child is going to live life with no arm or with no jaw. How would you react? How would your child react? Do you even know yourself, right? How is the mom feeling right now? Well, maybe you should ask the mom. Did you even ask the mom why she said something like that? In her own words, I'm not too sure. She's going to lose her arm. I don't think I can tell him or her. Maybe we shouldn't tell her. Maybe we should just, I don't know, maybe we should just tell her afterwards. I don't know what to tell her. Okay, what else do you know aside from that? Maybe you should ask her. Instead of talking about it in some fancy conferences, maybe you should ask her, how do you feel? And she'll probably tell you. I mean, she probably is not stupid or foolish, and she's probably thinking straight. She actually might be thinking the same way you would think if it was your own child. It's just a very difficult thing to swallow. Your own child will lose an arm or a leg, and you care about your child a lot, and you yourself are having a hard time trying to adjust to the situation and swallow the amputation. And you're trying your best to care for your child. You're trying your best to protect your child, and you don't know what to do. That's the reason why she said, I don't know. Maybe we should tell him after the surgery. She's distressed. She herself is having a hard time trying to swallow the amputation. So that's the situation. And you would have known that if you attempted some decent understanding. And it would work better if you have understanding plus empathy. Now, it wouldn't work if you don't think empathy is that important. It's like a customer with a broken car going to a car mechanic, and then the car mechanic looks at the car and just tells you what's wrong and what part needs to be removed and replaced. But human beings are different from cars. The mom is reacting psycho-emotionally. She's concerned about the psycho-emotional reaction of her child. The child will react psycho-emotionally. So it's not strange or foolish that she would say such things, right? How can you know the situation fully if you're not even making a decent attempt to understand the mom? How can you figure out what to do if you don't completely understand the situation? No amount of journals or articles or expert opinions in the planet coming from all sorts of ethicists with varying views is going to tell you what to do. The only thing that will give you a clue or a hint on what to tell the mom and how to convince her and how you can help her is to sit down, talk to her, and try to understand her. If you do so, you'll be surprised how simple the solution will be. Most of the time, it's just a matter of helping the mom cope, calming down the mom, and doing the disclosure, the mom, yourself, and if you really need some help, a psychosocial support person. Could be a child life therapist, or clinical psychologist, child psychiatry, child psychologist, or the psychosocial support arm of some palliative care team, whatever is available in your hospital. Now, let me warn you, most hospitals, not unless you're in some very well-resourced, developed country, in a very well-resourced, developed institution in that country, most of the time you don't have the luxury of getting psychosocial support help. Or you might get some psychosocial support help, but the amount of help they'll be able to give you will be very limited because the resources poured into those kinds of services are usually very little. So you yourself should learn how to do it. And what kind of caring providers are we if we are not even capable of doing so? If we're not capable of understanding our patients and our patients' parents in such crisis situations, which is very frequent in our field of work. We're not car mechanics, we're not machine operators, we're not prescription writers or body part removers. We're doctors and we're supposed to care for people. And you cannot care for people if you don't understand them or don't even make an attempt to understand and then empathize so that you can compassionately care. So what's the bottom line? What's the moral lesson of this story? Somewhat amusing, perplexing, or even intriguing things wouldn't look so amusing or funny or intriguing if you just spent some more minutes trying to understand the mom, trying to attain better understanding, and better yet, if you actually exercise a little bit of empathy. And empathy comes with caring. If you're truly a caring care provider, there's no provider who is caring without empathy. You need empathy and understanding for you to really care, right?